Hello. Today we are talking about vaccine diplomacy and the great performance of Serbia in the vaccination rollout. As usual, we are doing it with an expert. Today I am assisted by Giorgio Fruscione, Research Fellow at the Istituto per gli Studi di Politica Internazionale. Hi Giorgio, welcome up.
Hi Gianmarco, thank you for having me today at Understanding Politics. I will be very glad to share with you some information and views on Serbia and in particular on its vaccine campaign.
Tell us something about the numbers of vaccines and vaccinations in Serbia. How come they have more vaccines than people to vaccinate?
So, the very first thing to say is that Serbia is performing very well in the vaccination against COVID-19. It is the second country in Europe, after the United Kingdom, for number of vaccine doses administered per 100 people and seventh at the global level. The reason of this good performance is that Belgrade disposes of all main available vaccines. First of all, it has been the first country in Europe to receive the Sinopharm vaccine from China, which is today dominant in the country, as it received as much as 2 million Chinese vaccines. Other 2 million doses are coming in the very next weeks. But Serbia is also the Russian one, Sputnik, and those produced in the West, AstraZeneca and Pfizer. This is mainly the result of two geopolitical dynamics. The first one is the so-called vaccine diplomacy that is carried on by superpowers like China. This is a strategy implemented by China in order to penetrate Europe through the aid against the pandemic, as it did in the very first phases of the health emergency with the so-called mask diplomacy, when China provided assistance at the global level against the spread of the virus, and in particular to those countries where it has extended the influence in the recent years, like those of the Western Balkans and Serbia in particular. The second geopolitical dynamic concerns Serbia only. And Serbia in the last years has been, I like to say, swinging between the West and the East, because it doesn't have a coherent orientation in foreign policy, because Serbia is in fact formally oriented to the European Union as a candidate country, but it also cultivates political and economic relationship with both Russia and China. So, for years, this swinging foreign policy has been considered a factor of instability, while today this one foot in two shoes, let's call it like this, one foot in two shoes strategy goes in favor of Serbian citizens, because they can even choose which vaccine they receive.
How come they have such agile and effective mechanism of vaccine administration?
The vaccine administration of Serbia surprises also because the local health system is very weak and lacks of some fundamental infrastructures. However, when the first vaccines arrived in late December, the government organized the mass immunization through at least 200 public centers where people can get the vaccine. What is more interesting is that Serbia is not carrying on vaccination establishing priority categories as we see in the West, according to age, job, or even citizenship. Everyone can get the vaccine and at any moment, and I have several friends that already get the vaccine. So everything is organized through a system called e-Uprava, that is, let's call the digital administration of the country. So it functions like this. A person applies for the vaccine through an online system, and as I said, with the possibility to choose which vaccine they prefer. And after that, the system calls the person through an SMS, giving the information that confirms the vaccine chosen, the location, date, and time of the vaccination. This system works very well, not only in the capital city, Belgrade, but also in the rest of the country. And I have several of Italian friends that receive at least the first doses of the vaccine. So this confirms that the vaccination is going on not only for Serbian citizens, but for all people in Serbia. And one can even say that in the future, Serbia can develop a kind of tourism of vaccination, as it already exists with the dental tourism. So people coming from other European countries in order to receive the vaccine. One thing that I really like to add in order to partly explain this good performance in the mass vaccination is the experience from the past. In 1972, then Yugoslavia had the last outbreak of smallpox in Europe. It came from pilgrims coming back from the Middle East. And as we saw last year, the country at that time introduced restriction, isolation and curfews. But above all, a mass vaccination that in less than a month brought to the immunization of 1.5 million citizens. And of course, there is no direct connection between these two different events, but perhaps it offered the evidence that a fast public mass vaccination is possible. And what is even more interesting is that Serbia actually is implementing its own vaccine diplomacy at the regional level. First of all, Serbia has donated a few thousands of vaccines to its neighbors. President Aleksandar Vučić has personally handed vaccines to Montenegro, North Macedonia, and to the two entities of Bosnia and Herzegovina, Republika Srpska and the Federation of Bosnia and Herzegovina. So, for these countries, these were the very first vaccines they received, despite they participated at the COVAX program organized and implemented by the United Nations. So, to a certain extent, one can even say that in the Balkans, Serbia has filled the void left by Western institutions, at least symbolically, because we are still talking about very few thousands of doses of vaccines. Finally, in the future, Serbia will most probably produce the Sputnik vaccine and maybe even the Sinopharm. And if it really managed to implement such diplomacy, its influence on the countries of the region will surely increase.
How does this change the equilibrium between Serbia and the EU? It feels a bit like not only Serbia does not need the help of the EU, but also that it can replace the Union as a stabilizing force in the Western Balkans.
When the pandemic reached the Balkans, the European Union was ready to help the region. Yet, Serbian President Vučić criticized the EU for its lack of solidarity and looked for help eastward. As I said, China helped Serbia with medical equipment and is now the main provider of vaccines. What is doing China is to fill the void left by the European Union in the vaccination program. More in particular, China is also trying to replace Russia, the long-standing political partner of Belgrade, in order to increase its influence in the Balkans, above all in the framework of its global project called the Belt and Road Initiative, in which the Balkans are a strategic hub in connecting Southern Europe, namely Greece, with Central European countries. However, in my opinion, I believe that in any case, in the long term, Serbia and the Western Balkans should continue to follow the EU integration path, as the assistance and influence from superpowers like China and Russia could limit the countries of the region to serve their own interests and their interests only.
Thank you for being with me today, Giorgio.
Thank you for having me today.
I am Understanding Politics. Thank you for watching.